Fantastic. And we're live across Facebook, across my YouTube channel and my Facebook group. And today on the AJ Roberts Show, we are joined by Mr. Dan Astin-Gregory. Dan, how you doing, my man?
Great. Thank you very much. Very, very much appreciate being here today. And thank you for the invite, the kind invite to allow me to be on your show today.
Awesome, mate. Guys, I posted across like numerous social media platforms. I was holding a live podcast episode today. And the reason why I wanted to do it is because Dan, for those of you who don't know, has been doing so much work in the background and has pretty much been reporting on this whole pandemic since early last year when it all really came to fruition. And in the process, he's been working alongside and collecting all the data that you guys don't see. So obviously the data that you do see is very much sort of mainstream media led. We know there is such a thing called Ofcom. However, there are a number of alarming issues that are making people, very, very, very scared. Although we, totally agree there is a virus there, but there's a lot of things that aren't being told to people, which should be. So I wanted to get down on the show today just to elaborate on a lot of the things that he shares with us and has done over the last few months and has done on his own podcast, which is literally blowing up everywhere. It's called the Pandemic Podcast. He's getting some amazing guests on there, and absolutely kudos to everything you're doing, mate. But Dan, just for to put a bit of context behind what we're trying to do here, could you just explain to the viewers and the listeners at home a little bit about yourself and sort of your background, so people get a bit more understanding?
Yeah, so I spent 8 years in corporate in senior leadership, leading teams of up to a couple hundred people at times, and really developed a strong skill set for developing leaders, for developing strategy, to create change within an organization. Then I left in 2012 to start my own business. Had a real passion for taking what I'd learned in corporate and taking it out into the world. And then over the last 8 years, I've really functioned as an entrepreneur. And to me, entrepreneurship is about problem solving. It's about identifying issues in the market and then developing solutions to those issues. So I've worked with countless entrepreneurs to support strategic plans, helping people take ideas into fruition. I've worked with 40 or 50 different universities to help students
You still there, Dan? We got you.
Understand how? Sorry, I've just lost you. I lost you there for a sec.
Yeah. So that's good. We're all good. We're back.
We're back. So essentially, entrepreneurial thinking is at the heart of everything I do. I have a mission to elevate humanity and enrich the world. I've done a lot of work with digital media over the last 5 years to share content that can help people in their lives, a bit like yourself, AJ. And as it came to the pandemic, I've got a natural curiosity, and of course, I could see this was something that was going to affect the world. So, it led me to want to understand more about it. I've been like that ever since I was a child. I remember being 4 or 5 years old, and back in the days of VHS, the family guy around, you couldn't work it out. And there was me tinkering away, trying to figure it out and how it would work. And I actually said, I think it looks like this thing that's broken. And I was able to identify at 4 or 5 years old, with no real background, clearly no background in engineering, the problem. And, during my school years, I became the kid they would call upon if anything broke. So they knew my natural curiosity. They'd lead me to find the problems. And that's always been an underpinning skill set. It's a skill set that's underpinned my entire career. So to me, entrepreneurship is all about solving problems. And when I saw this pandemic emerging from its earliest days in China, I wanted to understand everything about it. So I started reading not only just the media, and I've always been cautious around media reporting, understanding that, their primary objective is to get your attention in order to sell advertising, really at the heart of it, as well as to inform you, of course. But I turned to scientific data. I turned to the scientific literature that was coming through, and it was coming through rapidly. And, by March, I'd read several hundred articles and publications on the situation as it was unfolding. And I've continued ever since, to try and really get to grips and understand everything about the virus, the response to the virus, the consequences of the response. And that's what led me to starting the Pandemic Podcast formally at the end of August. Despite commenting on it prior to that, that's when I started the show. And now we've done over 100 episodes dissecting the data, dissecting some of the core science, working with other analysts, other experts to try and make sense of it from a solution-focused point of view. Really, first to understand and be able to define the problem, but then to be able to look at, is the solution we're facing right now, is it the most effective solution that we could be adopting?
Yeah, and that's exactly why I wanted to get you on the show today, mate, because our beliefs are very much aligned, and I'm exactly the same as yourself. We're very like problem solving, focused and solution based, and I think like a lot of the biggest and best entrepreneurs out there, are exactly the same. Even even people like in construction and project management and all these kind of areas where you don't just see something for what it is. You see something very much as like, well, that's that. Like that, there's always a solution to the problem. It's not always, don't always take it verbatim, and that's the only way we've got to go. Especially when you get like a period into where we are now, where everybody's lives are been, in general, have been kind of turned upside down, for want of a better word. And it all depends what industry you are. Some people still are at work, and I think they, I can speak behalf of them. They're probably very grateful, and their day isn't like suddenly turned in from like very busy to completely mundane. They don't know whether the next penny's coming in, because at the minute there's like, and you'll know the numbers better than me, but there's over 1 million people, isn't there, like that have out of business, haven't earned a penny for sort of 9-10 months. That's a staggering number. And those people that haven't been earning also have people relying on them, like children, spouses, and stuff like that. And it's a really horrible time to be in for these people. And I talked to you before, like my own mum and dad have got a pub in Dorset. They've been open and shut 3 times, as well as having those restrictions placed on them. So they were like operating at, like, when they were allowed to open, they're operating at like 30% revenue for like 100% bills. And it's just, but you still want to open to try and get a business through. And regardless of them being, made COVID safe and thousands spent on doing so, it's just not actually, you need to shut again. So I think as much as people are taking a lot of information from mainstream media, and we spoke before, so like I saw Sky News yesterday, they said like 1,500 people died, when the people actually analyze all this kind of stuff, like, know that number isn't actually correct.
Yeah, so I'll pick up on a number of points there. So you mentioned about, the financial implications for a lot of people. There's actually a website called Excluded UK. Let me just get their URL, because for those who may be affected financially by this, there's a website called excludeduk.org, and their research has shown that over 3 million people in the United Kingdom did not qualify for any form of financial assistance. Many of them are entrepreneurs, company directors, freelancers, new startups, amongst others. So people have been really financially hit by this in many different ways. But part of the difficulty here is that because it's a very sensitive subject, it's almost like the economic conversation is being suppressed by the fact that it is clearly a very concerning impact of the virus, and people are losing their lives, and people always say, well, how can you talk about these other things when people are dying? And that, for me, it shouldn't be an either or conversation. They're intrinsically linked. We should be able to have the conversation about these, what I call the second order consequences, whether that's economic, healthcare, or otherwise. It's really important that we address what I call the harms that are caused by the policy, as well as the virus itself. But that kind of conversation has been in many ways suppressed. You mentioned about the data. There's a lot of real challenges with all of the data, and that's part of the. It's a large part of what we do on the podcast is continually review the data and dissect it to try and tell it for what it is, as it is, not worse than it is, if that makes sense. Because it's very easy to get caught up in these headline numbers that we see every day. But let's take an example. That you mentioned the mortality figures. I got an example here from the 6th of January, because I had that pre-written out. But it was announced that 1,041 people died on the 6th of January due to COVID-19. Now, there's a couple of points. That's a big number. It sounds scary, and the reality is that is still over that, regardless of actual underlying cause. That is 1,000 people that have died over a period of time, which is sad. And my heart goes out to anyone who has lost loved ones or has loved ones who are struggling. But nonetheless, it's important to understand how that number is comprised. So, for example, using the 6th of January, and there's a difference between the date of death and the date of recording. The date of death is the date that the person actually sadly loses their life, and then the date of reporting can actually occur over a period of time. So let's take the 1,041 from the 6th of January, and you can do the same for any number you see. But that 1,041 on the 6th of January was comprised of 22 people which sadly died between the 6th and 18th of December. We did 118 people from the 19th to the 26th of December. It included 326 people from the 27th to the 27th of December to the 2nd of January. It included 132 people from the 3rd of January. It included 284 people from the 4th of January, and then 154 people from the 5th of January. So you can see that number of 1,041 isn't all from the same day. But the way it's reported in the media makes it sound like they always say things. It's like the record number of people have died on a day. It's not accurate. It's not an accurate. It's the record number of people that have been recorded. In terms of that time frame, 326 was the highest number, which is a high number. But again, that was from a period of the 27th of December to the 2nd of January, which every single year, the winter season sadly leads to around about 1,600 deaths per day over winter, regardless of the pandemic. So the reason I make people aware, want to make people aware of this, it's important to contextualize the data, because we see these numbers, but we don't actually see, and they're presented in a way that creates shock. The newspapers are designed to do that, but it's important that we break it down to see the underlying realities, but then contextualize it against historic data, because we're always seeing the numbers around hospitals being overburdened, which is a reality. But when we actually then compare it to the past 5 years for each year, you'll see that the actual capacity numbers are relatively similar, even in the face of a pandemic. And if you look at any of the newspaper headlines, and I've reported on these, the last 8 years worth of Guardian headlines, essentially depicting the NHS in crisis every single winter, because it is in crisis every single winter. Now, the reality is that the systemic problem, yes, is exacerbated by COVID-19, and actually, indeed, a lot of the protocols which we could talk about. But the real problem is the NHS is underfunded and mismanaged, which is the issue that really needs to be resolved, because we'll see the same headlines in 2021, 2022, 2023 around hospitals being overwhelmed if we don't address that. So the data is important to help us measure the pandemic, but the way in which it's been measured and reported is deeply flawed, and that's a real issue. And I'm happy to go into more detail, but it's once you actually contextualize it and actually get to the core of the figures, you'll see a very different situation. Yet these figures are the things that are being used to determine the measures, and by measures I mean lockdowns, restrictions, protocols in hospitals, etc., which are actually causing these wide-reaching short and long-term consequences.
Mm-hmm. Yeah, and I think before we go on to sort of like the financial side of it, the costs and that, which I was listening to your podcast the other day about, like the money wasted and that. Just wanted to touch back on like what you were saying the other day, and it's I spoke with Emma Kenny about it on my recent podcast, because we were talking a lot more detail about the impact on mental health. But I find it just really, really alarming, and you kind of like almost like your hands are tied, like. What can you do? What can you do about it? Sort of situation when you have incidents that lady was talking on Radio 5 Live. A matron from a nurse from an actual hospital actively saying that the children's ward was overwhelmed with like really sick children. At the same time that the government or the media was telling everybody that this new strain is like highly infectious in children. So everyone was like really worried, and I'd hate to think about the number of families that were actively saying to their kids, like, you can't do anything, you can't go anywhere because there's a high chance you're going to be sick. And it's because of things like that. And thankfully there was specialists that came out very quickly, I'd seen on Twitter and stuff like that, and actually shut her down and was like, why are you saying this? Like, I'm the on-call like guy today. Like, this isn't the case at all. There's not an overspike of kids being sick and stuff like this. But then you've got Radio 5 Live leaving their post up for like a week. and it has like 2 billion views, and people see that and go, oh my God. And that's a problem. And then you have people like, young chap on Sky News saying that all the ambulances are queuing up and people being, and don't get me wrong, that there's a very good chance that is happening. I'm not saying that, but it was very quickly found out that the guy hasn't even worked for the ambulance service for like 13 years or something. And it's like, it just makes people, like ourselves who do that, who ask those questions and have that, just not trying to find a solution, but, just very, very kind of problems and solution focused. How can they get away with doing that? And, I'm pretty sure they're all Ofcom regulated, and like, why isn't anything actually being done or an apology even given? I'm not sure from your experience, like within the media, like how that sits for you.
Well, yeah. So I've reported more frequently on the media recently because the media are a big part of the issue, really. Historically, media's role, to a degree, has been to scrutinize and challenge government policy to ensure that their responses are appropriate, to ensure that there's no ill or untoward effects being created by political decision making. But we've really seen an erosion of that, and it's not just this year and last year. It's been long eroded, and it's really due to the shift in the media marketplace. And newspapers have had to turn to this real inflammatory reporting in order to get your attention, to stay alive through their advertising, their monetization, etc. So the media's been under threat financially for a long period of time, and the way they deal with that is by using clickbait headlines. But the reality is these headlines alone will often create the public perception. And you're absolutely right. Even if there's false information, that will remain in place. And it's really interesting to see fact checking and censorship in 2020 and 2021. Essentially, the things we see fact checked and censored are the things that question the underlying story. But something like that, which was factually incorrect and clearly incorrect, can remain without any further fact checking, without any further censorship. And there was a GP on Good Morning Britain on ITV talking about the vaccines, and you have to be careful about using the V word on social media because that'll lead you to a strike. And I wouldn't want to get you in trouble, AJ. Wouldn't want to get you in trouble, AJ. But she quoted some statistics that were completely incorrect, and again, that didn't get fact checked or censored because it was in favor rather than in critiquing. And I don't necessarily want to get into that subject around the V word, but these news headlines inform public perception, and as probably many of your listeners know, your perception creates your reality. And if you're seeing the same news headlines every single day, that becomes your belief about the situation. But most people don't look beyond. The reality is most people don't look beyond the headlines into the body of the text. And if they do look into the body of the text, they rarely then get the raw data or the raw science. And there's been countless examples. I've done these media teardowns where I've taken the article and I've gone through it to isolate what's inaccurate, and then taken people to the underlying study and said, look, there was an example where people were talking about the concept of long COVID, how it was affecting young, healthy people. Now, when I think of young people, I think of people younger than me. I'm 37. I think of people like in their 20s or even younger. And, I don't want to get ageist on this, by the way, be careful. But the average age of the person in that study was 65 years old, which is still young at heart, absolutely, but a little older than me. And they said healthy people, yet over two thirds of the people in that study had serious pre-existing medical conditions. And again, my definition of health would not necessarily include serious pre-existing medical conditions in a large majority of people. So it's really important that we see what's said in the papers is not necessarily a reflection of the reality. And just to give you another example, I had a ICU nurse contact me following a broadcast I did talking about the healthcare system and the challenges they're facing. And she told me of the 110 patients in the ICU that were categorized as being hospitalized with COVID-19, only 2 of them had symptoms of COVID, whereas all of the others were actually being treated for other conditions. But because they tested positive, they get included as the statistics. So they would be described either as asymptomatic patients or false positives. But the perception you see in the newspaper is that the hospital's overrun with COVID patients. And we kind of imagine all of these people coughing and spluttering, and they do exist, believe me. And it's a very difficult, tricky situation. But what we don't actually understand from the data itself is how many people are explicitly being treated for the condition as opposed to simply having a positive test. And there's lots of reasons why someone may test positive. and may not be infectious, but that's a whole different subject. But this perception we get of hospitals as being overrun, the ambulances, you're absolutely right, the ambulances, but it talks about it from one hospital or 5 hospitals rather than the multiple hundreds of hospitals that exist, and it creates a perception that that's happening everywhere, where it may only be happening in a few situations, and where it is happening, no one is asking what protocols are in place that is preventing getting people out of the ambulances into the hospitals, because we know everyone needs to be tested before they go in. And there's a whole range of these infection control measures that really slow things down, not only in terms of the ambulances, but inside the hospitals as well. So a lot of the work we're doing now on the podcast is calling out to NHS workers saying, look, we need to hear about this because we want to help. There's no us and them on this. This is about understanding how we can create solutions together, because a lot of the NHS workers, the doctors and nurses, are under a lot of pressure from the winter pressures alone, let alone being magnified by the tail end of a pandemic and the protocols. So it's really important that we help the NHS workers to deal with this, because they can't speak out. They're not allowed to. They're not allowed to talk about it in public.
Yeah, and again, that's the thing. I was having a conversation with somebody yesterday, a bit of almost an argument they were having with somebody else. So I was just like, I didn't need to. I just kind of like commented just to bring it back down to reality, because this was somebody who works in the NHS, and somebody who's very much into data and all this kind of stuff. And I said, this is a classic example that's happening all over the country, everywhere, of where the NHS is being used as an absolute scapegoat.
Absolutely.
Because they're massively underfunded, they're massively understaffed. They've got loads and loads of people who are being sent home as positive. However, you may seem that who feel absolutely fine. Again, leaving them more understaffed, and then people who are working are literally stretched and then having to do like double shifts and all this kind of stuff. It's just a massive snowball effect. So what happens over a period of time? Clearly, is everyone's got their own breaking point. Is that people in the NHS get to that point where they're just sick and tired of seeing people like saying, my life's upside down, mine's this, mine's that. And then you have the people from the NHS like who are getting absolutely smashed on their, with their jobs because they're so underfunded, understaffed, stuff like that. And then you get like loggerheads in the middle. When the reality of it, and the reality is that middle ground is the fact that the NHS is being used as a scapegoat throughout this whole thing. When the reality of it is, there's been so much money that has been taxpayers' money that's been completely and utterly wasted, that could have it could really help all these people in the NHS, their staff, the people who are massively underpaid. My wife's in like occupational therapy and that, and she wants to do the degree and go full time. And I said, well, what would your salary be like if you went full time at NHS? And she said like less than what she's on now as like an assistant. And I was like, what? Wow. And yeah, and that's the reality we're facing. You've got one of the biggest employers in the world, full of loads of staff who are underpaid, dealing with this pandemic, which is being made or told not to say anything. Don't just get on with your job type of thing. And then you've got the rest of the population whose lives have been turned upside down. And sometimes you look at like people's comments and stuff like that, and everyone does their own research. But when you see people go like, was no worse than flu, or was this and that, sometimes I actually take a step back and like, I don't actually blame that person for thinking like that because of the way everything's being dealt with. So what I was really keen on, and I was wondering if you could share, was just some of the figures that I heard on your podcast the other day about the sheer amount of money that the government has spent that's gone nowhere, that could have been used in the NHS.
I'm actually scrolling through my notebook now to try and find the actual numbers because I have this all written out. There has been an array of flawed decisions, and even just in the news this week, we've seen the scandal around the school meals. There's meant to be £30 per head, and you've got these little lunch boxes arriving that cost you could buy for under £5, and it's just an example of poorly managed contracts, and it's scandalous really, because people need these school meals because they're under financial stress. Yet we're seeing this really is it's a profit-driven initiative, which it really shouldn't be. So this is just one example, but I'm trying to find the figures now because the wasted money goes in the billions. If you just take track and trace alone, which has not been managed effectively, that's 22 billion. There's a hospital in Birmingham, the Queen Elizabeth Hospital, I think. It cost something like 500,000. 500 million to build. So you take 22 billion, you could build several, and that's state of the art. And now I appreciate, you're going to say, people say, Dan, you can't just build a hospital overnight. I know. I'm not saying that that's what's happening, but I'm talking here about long-term systemic investment. And that's a major scale hospital. But, I concluded, I'm trying to find the stats here. I do have them. That if the government had actually not wasted that money, the nurses have been calling for a pay rise for a long period of time. Depending on how you evaluate the effectiveness of a contract within the government, it worked out something like between an extra £1,000 per year to £18,000 per year per 1.3 million employees. Wow. There's 1.3 million employees, 1.2 to 1.3 million employees in the NHS. And if you divvied up all that wasted money, it'd be at least £1,000 extra each per year, or up to 18,000 if depending on how you calculate the effectiveness of this spend. So there's been an enormous amount of wasted money on faulty PPE. They spent an enormous amount of money on these overalls for NHS, but the contractor only delivered a portion of them, and then they didn't deliver the rest. And each coverall worked out £800. We're just talking like an overall here. You could go up to the hardware store and get one for £15-20. But they were costing £800 a unit. So there's been all of these really shocking expenditure decisions, and I always try and see it from all sides, and I think that's partly why the podcast has been effective. Yeah, and you think, okay, you're in an emergency situation, you're making rapid decisions, but there's no excuse. We're not in the same situation that we were in at the peak of the outbreak in April. You don't need to make knee-jerk reactions. You need to think carefully about your decisions, particularly, and a good leader will do this. And AJ, I'd be fascinated your views on this in leadership, because of your experience, your background. I'm sure you've been in many crisis situations, and you do have to think fast, but you still have to make the right decision. And we've seen the government, time after time again in this situation. Yes, it's a crisis, but they're not making the right decisions, and it's costing money. But it's not only costing money; it's actually costing lives. And I'm not just talking about lives from COVID, because that's our obsession at the minute. It's lives lost to COVID, but it's actually lives lost in other areas. There's 3% of cancer treatments have been cancelled in parts of Northern Ireland. Urgent cancer care. That's going to result in loss of life. I was talking to a statistician yesterday who broke down how much life has been lost for non-COVID due to the lack of access to hospitalization. There was over 15,000, it was close to 15,000 people in the first peak who lost their life because they couldn't access healthcare. The hospitals were at 60% capacity at that point because of the measures that were put in place to stop other patients getting into hospital. But that meant people couldn't get diagnosed or treated. And that's continued throughout the summer and into the winter. So, when we're talking about lost money, we're not just talking about lost money in the economy, we're talking about lost lives due to decisions that have been made. Yes, I appreciate it's a difficult situation. I do, but yes, we may be in a crisis, but I think the real crisis is what we've talked about already in terms of the way it's being portrayed rather than the underlying reality, and it's preventing us from making the kind of decisions that we need to be making that reduces all harms, because that's my outcome in the work that I do, is to reduce all harm, minimize all harms, not just from the virus, but across every area of human life, because this, as we've talked about, affects all areas of life. So, as I said, I'd be interested to hear your views. Decision making in a crisis, it's not easy, I'm sure. No. I've never been in a situation that's life or death, but it's
yeah. For me personally, I think you've got to look a hell of a lot deeper to like what you see in front of you, because at the end of the day, whether it's Boris or Mr. Hancock and all those type of people, they're in those positions because somebody needs to do that job at the end of the day. We need the Prime Minister, we need the Health Secretary, we need all these like ministers and stuff. So I think they're not necessarily like leadership born and been in those real positions where they're actually leading people. So it's easy to just like point at them and say, oh, it's all your fault. I hate you. I hate Boris, I hate Hancock, this, that, never. At the end of the day, they're just like relaying what a large group of people have basically decided. I think looking back from that, strip that right back, and then you have people like the Sage Group and all those kind of stuff. These people that are supposed to be advising. One of the key things you do in the military, and this is not just from like my level as a soldier on the ground, but like battle group level, like all this kind of stuff. You always they always look at like second opinions. Not just saying like the one person goes, right, no, this is what we're going to do. The best leaders will always surround themselves with, thought leaders and stuff like that. And that's what they do. and they take a collective of thoughts and a collective of ideas, and they were always the best leaders to have. They're the best leaders to follow. They're the ones that you would go over the trenches with, you know what I mean, and scrap with, because they're not been really didactic and gone like, right, no, it's my way or the highway. And that's, for me, from the outside, that's what it looks like. What's happening is like the government are taking all this advice from Sage Group and not seeking a second opinion from anywhere else. And if you're going to do a second opinion, maybe have a look at the people who are banging on these governmental doors, who are like Nobel Prize winners in like chemistry and stuff like that. I say, no, look, like this is what you're doing wrong. This is the detrimental effect you're having on like mental health en masse, like we've never seen it in adults and children. This is the effect that you're having on like people's lives as a whole, with business. Like I said earlier, over 1 million people not earn anything for 10 months. And like this is the actual science, and even going down into the whole mask situation, there's so much scientific evidence there that is saying to everybody, and I'm not, and again, I want to reiterate that, like, if you listen to this podcast and you're sort of taking science away from it, it doesn't mean go out and just like do the opposite of what the rules are. That's not what it's about. And I would never, you're just stupid if you do that. But the science is all there and has been pushed and pushed and pushed to number 10 to say that, like, masks clearly don't work, because we were, it got brought in when the peak was supposed to be at its lowest, and then obviously it shot right up, but obviously testing shot right up. And it's just, and that's what's been my biggest bugbear from a leadership standpoint of view. And I've had this conversation with, many ex-military people from where we've talked about this from our experiences. And at the end of the day, MPs aren't soldiers or ex-soldiers. There very few of them are. You've got some that are embedded in there that are. So it would be interesting to hear their thoughts, really. Obviously, ones that from Conservative and Labour, like,
absolutely,
not just one-sided. But so that's really like my standpoint, and I'd like to see them actually take a collective of ideas, really, rather than just have or whatever they say is verbatim, especially with something in our lifetime we've never seen on this scale.
Absolutely. And to me, again, going back to the solution focus on this, it's really that second opinion is so important. The scientific advisory group, their primary responsibility is to look at things like the case numbers, the hospitalizations and deaths, etc., as well as understanding the virus, etc. However, our lives are far more complicated than just a virus. And we have oversimplified life in 2020 to focus myopically purely on the pandemic via the virus and all the numbers surrounding that. But we have not given enough focus to every other facet of our lives, whether that's the overall healthcare system and overall health outcomes, the mental health outcomes, the impact on suicides, the impact on domestic violence, as we've seen increase, the impact on the economy, the impact on individuals' livelihoods, the impact on the people's ability to go to weddings or get married or go to their loved ones' funerals or go and visit dying loved ones. Some of these things you cannot quantify. It's intangible. But my belief is that we should have a multidisciplinary team that looks, yes, at the science and the data, but also looks at the impact on and I didn't even mention the children, the education, the education system, and how young people's lives have been disrupted and psychologically almost permanent damage for many have been created. So how do we look at the situation differently? My view is we need a second opinion, but we also need to incorporate these different areas: the economy, business leaders, education leaders, mental health leaders, all of these different segments, to actually evaluate the whole situation to minimize overall harms. Because if our goal is purely to target case numbers, we're no longer paying attention, and that's what's happening. We're no longer paying attention to overall health. We're no longer paying attention to overall mortality or excess mortality. We're just myopically single-minded on this one number, reducing cases, where we're no longer looking at what harm are the cases causing, because not every case is equal. Not every case is even a case. Rather than looking at the whole picture then as well across the whole spectrum. So a big part of the work we're doing outside of the podcast is bringing together these different experts. And it's important that we don't just go off into silos again and just go, you're for lockdowns, you're anti-lockdowns, and just polarize, because what we'll see is this an emotional outburst, and it takes us away from the adult body to body, person to person, adult discussion about the realities of the situation. Because my experience here in dealing with this is when I have an adult conversation with anyone who perhaps is probably more in favor of lockdowns, when we discuss it, there's a lot of misunderstandings. There's a lot of issues that haven't been factored in or looked at as part of their decision-making protocol, which has largely been informed in most part by the messaging from March and April last year. So our goal is really to bring people together to scrutinize the data. And by the way, there's a heck of a lot of dead ends. There's lots of data that we don't have, full stop, that we should be collecting. And again, as a leader, as a business leader, I've got a dashboard for my business. I'm looking at what difference different marketing campaigns make. I'm looking at my costs, all of these different customer metrics. I need all the data to be able to assess how things are. But if we don't have the data, or the data is flawed, or it's been misrepresented, then we can't make accurate decisions. So we need to bring people in from all schools of thought to actually scrutinize it, but to agree upon a common goal, which to my mind should be to minimize all harm from all causes, not just the one COVID-19, because the reality is it's an age graduated condition, and that means that the average age of mortality is 82.4. It's on par with our natural all cause mortality age. The majority of people that have been hospitalized due to the condition are over 70 years old. Yet we're being told by the government to act like we have the virus. And you're seeing people walking into the main road to avoid one another because they're afraid of walking past someone. Now, if you speak to anyone that's an expert in viral dynamics, you're not going to pick up a virus by walking past someone. You may do if they cough explosively at you, and you get, a stream of, debris, viral debris in your face. But the likelihood of that happening is extremely small. And outdoors, even if it did happen, it would be still small. Yeah. So to me, it's about really understanding the realities of the situation and then coming up with proportional and appropriate responses to minimize all harms and enable, the young, healthy, and fit to resume normal life, because they're least at risk. And actually, by doing so, we've been told we're putting granny at risk by doing that, but actually the reality is the concept of herd immunity has been politicized. But you and I, if we get an asymptomatic case, or we get a very mild case of the disease, we're actually going to build immunity, and we're actually going to help the herd as a whole. The vast majority of people won't get symptoms; they won't even know about it. Yet by doing so, it's already been shown that we get antibody response and T-cell response, which actually protects us. And by us becoming immune, we actually then go on and protect the vulnerable. But that's been suppressed. That's the opportunity to do that has been largely taken away.
It is alarming. And I touched on the mental health side of it with Emma Kenny in our podcast. The fact that those schools are now closed, teachers are doing their best to teach the kids via Zoom and Teams, this, that, and the other. But the reality of it is, we're in this time of year when there's not much daylight. The kids are glued to a screen, for ones that can actually do it, because there's thousands and thousands of kids that can't even do anything because they don't have devices and stuff to be able to do it in the first place. So they're actively missing out on education, and then it's they're just glued to a screen all day and isolated away from communicating with each other, just like a lot of people are at the minute. And I think for me that my biggest beef on this whole thing is that the way the mainstream media has portrayed that, the numbers and the misinformation, which is it's just wrong on so many levels, but to the point where it's almost, it has literally scaremongered millions into thinking that they're walking around ill, or their kid is going to be walking around ill, not to do anything, not to go anywhere, not to be human, because they're very likely going to be ill. And I often jump onto threads of my local journal, Facebook newspaper and stuff like that, and see how, every time, and they're just constantly, just every hour, it's like something COVID negative. And then you just see people bitching at each other. So I like to read them to see, because I'm very interested in people's mindset on this and what leads them to make that decision or the way they're doing now. But it just shows you how different every single person's life is. Every single person's circumstance is different, so every single person's view is going to be different. But it also shows you the quite alarming level at which people's only outlet of media is the news, morning, lunchtime, evening. And it's kind of it's not a battle that's going to be won. It's not a battle I'm trying to win. And I keep saying to people, I'm not trying to say to you you need to believe what I believe. I'm just saying, here's some actual factual information. Do what you want with it. If you go and suddenly want to go, get a jab, it's completely up to you. I ain't going to judge anybody like that, and I never will. Just like I don't judge people who smoke, who drink, who do drugs, and who eat loads of like fast food. It's completely up to the individual. But what I do think needs to happen and quickly is not just within government, but even like maybe a step down from that, is these like thought leaders and people in very influential positions in business, in finance, in health, nutrition, and everything else like that need to actually come out on en masse, actually get a grip of the situation and actually influence people in those areas where they're really struggling. So people who've lost all their businesses, for example, and there is millions. I explained last week, I had a veteran who contacted me on LinkedIn. He sat there with a load of pills and a bottle of Jack Daniels in front of him, wanted to end his life, and he's got a wife and 3 kids. Luckily, I talked him around. Unfortunately, I had to use the suicide of my best mate 3 years ago, the military guy, to stop him from doing it. And I was kind of questioning myself. Like, it was really actually quite taxing. That night, I didn't really sleep much. I was just like, wow. And we've sorted him out, but there's millions of him out there right now. And that was based off, he was in the hospitality sector. He was in tier 2 on the 29th. And then on the 30th, it's like, no, you're not going to have New Year's Eve. You're not going to be able to fill what people you can have into your restaurant, and all the stock that they had from the last of their money was gone. And that was the same for so many people who were in that position, like hundreds and hundreds of people. And it just kind of got to him by the point where he spoke to me about it. So what I'd really like to see is some take away the negativity, the constant negativity you see every day across all mainstream media of like death, and and cases, and actually someone coming out and say like, right, we know this is actually everyone's in a bad situation. However, to improve your health, your nutrition, and your immune system, this is the best way to do it. There's so many businesses that have gone under, or people that might want to be looking to create multiple streams of incomes elsewhere, not just leave it to people, not just leave it to entrepreneurs to do that. Someone of real stature to come out and actually take commands, and I don't mean overshadow the Prime Minister in that way, but like all that's delivered on a daily basis is just negative news, and at the minute it's just getting worse and worse, and it's just like that screws just being tightened on the public, and that's again, that's another thing. It's just that every single day it's like, public have done this, the public's fault, the public's fault, the public's fault, and again, that's another argument, like save the NHS, whereas like as taxpayers, we pay for the NHS to save us, and it's kind of, and that's the argument I'm seeing all the time. What's your thoughts on like sort of, I call it short term, like the next 3 months? What would you like to see happen from a government level? I know what the best obviously solution would be, but the way the stance they have right now, what would you like to see over the next sort of 3 months?
Well, I firstly agree with a lot of what you said there about these impacts, the mental health impact. You can't quantify; it's difficult to quantify that. In the early days of my business, I went through a lot of financial struggles, and my mental health took a real toll during that time. I didn't quite go to the brink, but as close. It's dark. You can go to dark places when you're financially struggling, and there's lots of evidence to show that the mortality increases dramatically during times of poverty, which inevitably we'll see. So I just want to echo that, because it's so important we factor those into the conversation. And to your point about what I'd like to see happen in the next 3 months, I'll firstly address that from what I would like to see, but I'll also talk about what we're actually doing locally here to address it, because action is required. From the government perspective, I think they need to engage with different expertise first and foremost. I appreciate it's a difficult situation, but we must scrutinize the data. It's really important. It's really, really important. To me, the real crisis right now is the crisis of data and misunderstanding, misrepresenting, and misattributing the data. Because as long as that continues, we are going to be in a very, very dark situation. So firstly, we need to get the data scrutinized. I spent 4 hours yesterday on back-to-back calls with data analysts, data scientists, statisticians, looking at graphs, raw data. And I came out of that feeling completely calm, and then I opened the newspaper, and boom, straight back into chaos. We need to be scrutinizing the data. But we also need to be seeing the situation as it is, not worse than it is. The press will always present it worse than it is, and that informs our perception. It is a serious situation, but we must also address some of the protocols that have been put in place. For example, during the first period of lockdown, something like 27.8 million GP. We had close to 27 million less GP appointments than the same time for the previous years. That's a massive blow to the healthcare system. Right now, in the race to deploy as many vaccines as possible, once again, GP surgeries are being asked to prioritize vaccines over normal care. And this is going to have a significant impact. So we need to be looking at a balanced view on this to review which protocols are effective and which ones are causing harm. And then ultimately, there is just over 68 million people in the United Kingdom, and there's approximately 15 million that are over 70. I think I'd have to double check that, so don't quote me on that. I need to review it. But given the age graduated nature of this disease, my view would be that if we collaborated together to form a shielding strategy and work together as a population to be really effective in doing that, not only would we protect those who are most vulnerable or most likely to experience severe disease or worse, we would actually enable the economy and society to recommence. And all of that, I believe, should be done on an opt-in basis. If you want to shield, it should be optional, because, if you're 90 years old, you could be taking away someone's, pride and joy in the end of their life. And similarly, if you're under 70 and you still feel threatened, you still feel afraid, then again, you shouldn't be forced to do things that you don't feel comfortable. So, from an entrepreneurial point of view, when I hear the rebuttals against shielding, the criticisms, I think, well, surely we've solved more complicated problems than figuring out how to shield the most vulnerable members of society. Now, the counter argument is, well, people under 70 can still get sick. And that's true. They can still get sick, but the proportion of severe disease is exceptionally low, particularly for those who don't have other existing medical conditions. So there is always there is an element of risk, but we shouldn't be making decisions on the exceptions. We should be making decisions on the whole. And that would be my plea, would be to see the government approach, to revisit the focus protection strategy, but to really challenge some of those objections to it, because, with the greatest minds in the world, I'm pretty sure that we can come up with an effective shielding strategy that reduces or minimizes severe illness and risk, whilst enabling the rest of society to function at normal.
Brilliant, mate. And I absolutely love that. And I totally wholeheartedly agree with you. And I think it's just, instead of just jumping on the news and going like, right, as of tomorrow, you're going to do this and this, right, tightening the screw. I think it'd be good to see, people actually come out and say like, give some more positive news.
Yes.
Some actually more constructive solutions, because that's one thing I've not seen in months, is actual solutions to the problems that are going to be caused on a mass level. It's just even when you sort of like hear the Prime Minister's questions and all this kind of stuff, they ask them questions, and the questions is very much dodged. There's never it's quite comical. There's never a solution or an actual real answer to anything. So I'm just kind of like, what's the point of even putting it on TV? If you're not actually meeting the objective of it, like whatsoever. But what I'm quite keen to see personally as well, from a local leader point of view, is a lot of the MPs who are or mayors and stuff like that of big towns, city, villages, wherever. We're all like under the same rules and guidelines that need to be followed, whatever. But I'd quite like to see a lot more local leaders actually coming out and saying like, right, like, because I live in Salisbury, for example, and I actually really like what I've seen here. And everyone's just like really chilled and relaxed. The police are just like, how's it going, morning, stuff like that. So at the same time, whenever people are getting arrested for coffees in Derbyshire or the people down in Bournemouth, at the same time, I was like down near the police station, and it was just like saying hello, having a chat. I really like what's going on here. So you can't tar like every town and everything see the same brush. And I think people really need to remember that. Just like on the flip side, I really see people's frustrations when they say, the public can't do this, public aren't doing as they're told, and but all I see is people doing as they're what's being asked of them. and trying to get on with their lives. You can't tar everywhere with the same brush. What might be, people just totally mugging it off in London doesn't mean people in Cornwall and Dorset and, other places up north, conforming to the same problems. They're just trying to get on and, help each other out. So I think from a leadership point of view, local leadership would go really far. I think if people actually started standing out and really coming up. And this is why I wanted to do a podcast like this with yourself and lots of friends that are like really big influencers and online and different niches. Are trying their best to do so. So I think that's why your podcast is like taking off, because you're not on your podcast. You're not just going like, right, the government's totally wrong. They're just a bunch of muppets. They're this. Believe me. It's all it's a very, very constructive and subjective conversation that offers solutions. And I think we're missing out on a massive grand scale.
Well, on the local level, that's the second piece of my point here, is that there's 2 points to this. Number one is we can't wait for change to come to us. We have to lead change. My primary message, my primary goal is to educate and inform through the podcast, but it's also to empower people to be able to affect change. So a lot of the problems we're seeing unfolding now, whether that's in the business community or mental health or any other facet of harms, it's down to us to create solutions, right? So don't wait for the solution to come to you. Become the solution. Be the change you want to see. That's a big message I share with everyone. But on a local level, I'm in the next couple of days reaching out to the mayor, the elected MPs in our area, but also the unelected MPs who are active in the area, the police force, the chiefs of the hospitals, to say, look, we've identified some real issues with the data and the science. Can we locally in Bristol, where I live, examine the data? We can do it in collaboration with Bristol University. I'm looking to incorporate Bristol University because they've got an entire team that have been studying the virus and the pandemic since the very beginning. In fact, they've got one of the world-renowned experts on coronaviruses, full stop. So this isn't about just pointing fingers and saying we need to do things differently. It's about saying, can we sit around the table and look at this? Because some of the data issues, when you tell people about it, they think, well, there's no way that's happening. It's too unbelievable. It's that level of unbelievable, but it's true. It's a reality. So, for example, let's look at Bristol's ICU, the general acute care. Let's work with the hospital directors to say, okay, how many of you? Let's have a look at the patient base that you've got right now. Can we categorize people into symptomatic people who are receiving treatment exclusively for COVID-19, for example? Can we then categorize those people who are symptomatic but also receiving treatment for other causes, and then categorize the last category of those who are asymptomatic, they've tested positive, but they're not actually being treated for COVID-19, they are being treated for other causes, so we can actually get a real understanding of the burden of the virus on the healthcare system. But then can we have a look at the protocols? What's leading to so many staff being absent because it's the same story that they've been testing positive for COVID-19. They don't have symptoms, but due to the assumption that asymptomatic transmission is a major driver, that these protocols are put in place. Yet, the last 15 studies that I personally read on asymptomatic transmission shows that it's typically negligible or even zero in some of the studies. But going beyond that, I'm not saying it doesn't have an impact. The point is, let's look at it and actually confirm let's look at the assumptions. And I do this with startups I work with. I do this in business. Let's identify the assumptions and then go to work as rapidly as possible, as effectively as possible, to either prove or disprove those assumptions. Because until we actually challenge the underlying assumptions behind a lot of these policies, we're screwed. So on a local level, I say we're screwed. It may materialize that is the best course of action, but we've got enough evidence to show that a lot of this assumptions that a lot of this is predicated upon are flawed. But we must prove it. We can't just go on Twitter and say that these things are wrong. We need to actually prove it. So one of the goals I have here in Bristol is to work with the local decision makers, working with the expertise in-house at Bristol University, as well as the contacts that I have around the world who are world-class experts in this field, to really challenge some of these things, to identify the assumptions, to challenge them, and to lay out the data and to see things as they are, not worse than they are, and then seek to create policies. And if we can, on a local level, if it materializes that actually we see that the policies are flawed, then can we become an A/B test? Can we create a bubble in Bristol where we do things differently? We've seen it in other countries. I think in Denmark, they did things differently by different area. They did lockdowns in one area, then they did no lockdowns in others. Ivor Cummins has spoken about this. He spoke about it on my podcast. And the results were fascinating. But, in business, we wouldn't start a marketing campaign without testing it against control. We don't have a control. We don't have an A/B test here. So my goal locally is to instigate that. And again, if you're watching this at home thinking you'd like to play part of the change, then get involved, because it's down to us to lead that change, and it's down to us to engage with MPs. And my view is we've tried informing them by writing letters and sending information and studies to MPs. But the reality is we need to sit around the table and discuss it, because it takes a level of understanding to understand the science and the data. The majority of the people in Parliament aren't scientists. They're not statisticians. They don't have a background to understand this stuff. I don't have a background in medicine. I studied economics with advanced statistics, so I have a grounding in statistics, but I lean on a whole range of experts who are experts in their field. Mm-hmm. And that's why I want to collaborate with the likes of Bristol University, who are studying this day in, day out. Because when we do that and we collaborate together and we scrutinize together as one, with the common goal of minimizing all harms, I believe we can create real change. And that's my message. And, people can be doing this on a local level. With the work that we're doing with one of the initiatives I'm running, we're looking to roll out what I'm doing in Bristol on a national level. We're creating what's called the Burden of Proof campaign, which is about placing the burden of proof on the decision makers. But I say burden of proof, it's a catchy title, because so far, we've tried sending in science to SAGE, we've tried sending data to the politicians, and it's not being engaged with. So we need to create a level of engagement. So it's really about involving decision makers into that process, so they can find the insight for themselves, but we will guide them then in terms of the interpretation. So there's a lot of work we can do locally to evaluate critically the situation we're in, and challenge the assumptions upon which things have been predicated upon.
Yeah, and I think on a local level, like all around the country, I think people are just desperate to see not just change happen like that, but like just some positive actions being taken by people to do things to help others. Because and I'm not saying like sway people's opinions, but I mean just giving them that bigger, broader understanding of what the reality is of what we're actually facing, rather than like saying mainstream media. So I think the more people could do on a local level, whether that be in health and business, entrepreneurship, like all that kind of stuff, getting people more involved with things outside of what's kind of happening will bring a lot more positivity to people's mindsets and mental health, way to go about their day. Because there's millions of people right now, and including people who are on furlough, who when they're not at work, it's kind of like, oh, what do I do? Netflix, this, that, and the other, and then it's just mainstream media, and it's just negative. Everything gets very, very mundane, and everyone looks for that light at the end of the tunnel, on a daily basis, and then someone else will come up on the news, and then it's kind of like, oh, it's going to get longer. The screws tightens, and you can see just see it like in a supermarket, for example. You just see everyone walking around with fear. Everyone's scared. Everyone's just fed up and just don't know when it's all going to end. And I think the sooner we as a collective can bring some real positive more positive outlook and positive change to people around the country, I think the better, because they're not getting it at all from the top. All I see from the top is like tightening the screw, and then the blame set from the top. And that's one of the biggest issues for me, is just you just see people blaming everyone else. As soon as a report comes out like, oh, now we have to do this tomorrow, we're going from like tier this to tier that, or going into lockdown, or as of this date you've got to do this. It's just like boom, blame just goes like that. And every press report is like that they've done has started along the lines of, well, due to the public not doing this, or due to the public needing to save the NHS, due to you guys, it's just that shift of blame very quickly. And you'll see it like all the time at corporate level, the blame culture that you get sometimes in this modern era. That's the blame culture we're in, and it's not useful. It's just not useful. It's useless pointing fingers at people. We need to collaborate. The reality is there is solutions available here. And it's important to challenge assumptions across all bases. You talked about it's not necessarily going to come on from high. The majority of MPs in the House of Parliament, they're not from a scientific background. They have the SAGE group. But then again, it comes down to challenging assumptions. For a long period of time, at the early stages of the pandemic,
There was no immunologists. There was no immunologists on the Sage group. This is a disease that affects the immune system, yet there was no immunologist. In fact, what it's been established is the immune response is part of the real problem in terms of its severity. So to not have that on the group at the outset is deeply flawed. So we need to challenge every part of this, and we also need to look at, Dr. Zoe Harcum and analyze this, the conflicts of interests within the group. The top 20 advisors in Sage Group, 14 of them have financial or working incentives, financial incentives or working arrangements with the vaccine manufacturers. Now that's fine, but it should be balanced, not dominant. 70% of the advisors are connected to of the core advisors, the top 20. She found. Now there's more than 20 individuals involved, but the top 20 are involved in the majority of the meetings. And of course, that becomes an ideology, and lockdowns can become an ideology. So my argument is this: we've got to strip away the ideology, strip away the politicization of this, strip away the blame, and just come back to center and say, let's look at what we've got from a balanced perspective and revise. And then to your point about neighborhoods, your friends, family, I had a voicemail from a friend of mine who's one of the most happy, optimistic people I know. That he's literally the most gregarious individuals, but he left me a long message saying he'd been depressed and he was feeling really down and needed help. So my message right now in closing really is this: there's three things we need to do. Number one is we need to look after ourselves. Self-care is the most selfless act. If we can't look after ourselves, we can't look after others. So if you're struggling, number one is you got to reach out for help and take care of yourself. Number two, you got to look over your shoulder and look at your neighbors. Whether that's a virtual hug, we need to be looking after each other in our community. So, get in touch more frequently with your loved ones, your family, your friends, because you just don't know what they're going through. And then number three is we need to then work beyond ourselves and beyond our networks and to start making a difference in the world, not only right now in terms of the pandemic, but beyond it. My call to action is the call to lead. I was so excited entering into 2020, a new decade, an opportunity to really see positive change in the world. But we can't wait for that positive change to occur. It's down to us to lead that change. And AJ and I both share this. If we become the best versions of ourselves, then we can truly make a positive impact in the world. So we've got to double down on self-care, double down on caring for our neighbors and our loved ones, but then double down on caring for the world. And the best way to do that is become the best version of yourself. And that's how collectively we will get through this.
No, I absolutely love that. And, I couldn't agree more. I like the conversation you had with a friend the other day. I've had several conversations like that over the last several weeks with people. I get messages daily of people struggling. I just want to reach out, which is good. It's good that people are reaching out. And if any of the people are listening, you're having like a real tough time at the minute, because there's hundreds of thousands out there that are really struggling. Everyone from like single mothers that have like, young children that can't do anything or go anywhere. And, it's really, 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 really tough. Everyone's having it. But if you are that person, reach out to somebody and just explain what your issues are, because I'll tell you what, there's a very good chance that somebody else or the person you speak to is having a tough time as well. And you can just lean in on each other. But I want to thank you for coming on today, mate. I know how busy you are, and I appreciate you are, and I love absolutely everything you do. I think the podcast you've done and the message you're getting out there, like we just spoke about then, about trying to come together and at least trying to get the message to the people at the top to just sit at the table and say, look, at least look at second opinion about what's going on. And that's not just because like we're all upset and fed up, but we want them to change their mind. It's like to actually, like you're saying, present that actual data that people like yourselves have spent so many months on actually collecting and presenting them with that, so hopefully they can actually make a better longer term strategy than the one we're currently in now. Because I'm sure if you did a poll and the actual mainstream media actually posted the correct poll, it'd be crazy to see what the actual numbers would be if someone said like, are you happy with the current situation being in lockdown? I don't know anybody who's not been paid for 10 months and whose business has gone under screaming for them. So it's great for you to have people like yourself to come on with your expertise, and like you said, the people that you work with and you lean in on a daily basis, and the work that you're doing, from the minute we get off this till and onwards, mate. It's really commendable, mate. And I hope that there's a lot more Dan's out there that are doing similar things and are trying to lead from the front and actually bring some solutions to problems. So thank you, mate.
My pleasure, and thank you for having me here. For those, if you've been listening, you're interested in checking out the show, we do the Pandemic podcast. You'll find it on my personal profile. You can just click on my name here. And if you're interested in subscribing, if I can share, AJ, it's danjgregory.com/pandemic, and you can check out the content that we're creating.
Thank you, mate. And when I actually, I'll upload this to the actual, my actual podcast itself and the YouTube channel, so, on Apple and Spotify and stuff. I'll put all your stuff in the show notes so people know where to find you as well, mate. And yeah, for the people that are watching, look, just have a look in on Dan's podcast. He usually does it via Facebook Lives. He has some formidable guests on there, like real thought leaders in the world of business, economy, finance, entrepreneurship, and stuff like that, and stuff you can actually get some real insights and learn a hell of a great deal, guys. And especially if you're sat around at home, and you're running out of Netflix series to watch, start sort of consuming a bit more positive content. Listen to likes of Dan. There's loads of things going on at the minute out there that people are really trying to do to warm people's spirits and get people going. And that's my main message today is, other than trying to add some solutions to people's problems, perhaps today, is the minute you get up in the morning, just try and fill your head with as much positive content as possible, because it's going to be a long dark days, guys, if you're just consuming all this negative information through mainstream media and everything that's going on. It will make your day a hell of a lot worse. So get yourself around positive people, like-minded people who want to see you win, who want to help you get out of the situation you're in. If there's something that you perhaps want to do, you're not sure how to do it, reach out, find a coach, find a mentor, find a support group of people that just want to see you do better in life. And like we were saying earlier, help you to try and be a better version of yourself. Because as soon as you start taking yourself down that little journey, your whole life and the things in front of you, the doors that will open will become second to none. I can promise you that. I'm living proof of it. Thank you so much, Dan, for coming on. Thank you guys for tuning in.
My pleasure.
Thank all those that tuned in across all my channels. Thank you very much. Anyone wants to speak about anything, or anyone's got any serious problems, please reach out. I'm always there to lend an ear. But please, guys, enjoy the rest of your day and take it easy. Much love.
Thank you.